everyone, Hillary here from Lébo Aesthetics Spa. I am here talking about CoolSculpting today. So CoolSculpting is one of my favorite treatments to perform. I love the results it gives to patients. What we use it for is definitely those pockets of fat that if you've been either on a journey of weight loss or you're just somebody that exercises, takes care of themselves, and they have these stubborn areas that just won't go away. That is what I love CoolSculpting for. It can be used for larger areas, but it's definitely something that it's great for these pockets. If we can pinch it and squeeze it, we can get rid of it. And the way that CoolSculpting works is all of these applicators that you see up here treat different body parts or different little pockets. So we have like little small ones, great for underneath the chin. We have large ones like over here on the end. That grabs in like a larger pocket of fat that was really good for like a lower abdomen. And then we have some of these smaller ones, could be good for an arm, could be good for like a pocket of fat that's maybe in this way. Sometimes in women, we treat more like a diamond shape because a lot of times we have like actually like a pocket here, and then sometimes like two pockets up here or maybe one pocket. So it might be more of a triangle, just depends. Bra fat, it's great for. But basically what happens with CoolSculpting is we draw that pocket of fat into this cup. And the cup, of course, is attached to a arm here, which then the machine delivers really cold sensation all through here because these little conductors here get really cold. As that fat freezes, and usually treatments range anywhere from like a 45-minute on a large one to like a 35-minute on the smaller one. Outer thigh we can do, that takes about an hour and 15 minutes. It's a little bit longer of a process. But you sit there with this applicator on, and as that's freezing, it feels a little burny sensation, a little uncomfortable for like the first 5 minutes. Then it typically kind of feels numb and it doesn't really bother you. And you're sitting comfortably in the chair, watching TV, you can bring your phone in, you can read a book. While that's freezing, you are laying there comfortably, just doing your thing. I'm not always in the room while we treat you, or the provider's not always in the room. We get it started, make sure you're comfortable, and then we step out. We get a text message to let us know when your cycle is completed. When it's complete, we come back in, we take the applicator off. It's pretty cool because that area of fat that's in there, your tissue is protected, but that fat freezes. And when we take that applicator off, it's actually almost feels like a frozen stick of butter, where we could almost put our finger in and have almost like an indent. So then we massage that area for about 2 minutes. When we massage that, it gets it really soft again, so it's not going to be hard when you walk out. Could be tender, could be a little bit uncomfortable, but it's usually tolerable. I tell patients you can go work out afterwards if you want. There's no limitations to what you can do, just do what you're comfortable with. Some patients that we do like on the abdomen, their seatbelt, when they put that on, could be a little uncomfortable because it's sitting right there, or like tight pants that are sitting right there could be a little uncomfortable. A bra, if we did like bra fat, that like sitting against that, it just might feel a little achy, but most patients are fine afterwards and they'll just say it was a little tender, but it was fine. Your body then processes that fat out of you over a 16-week period. Some patients are lucky, and in 6 to 8 weeks, you really see a big change. Others, it takes the full 16 weeks. I usually like to do a follow-up in about 8 weeks and then one more in 16 weeks. Sometimes one of these applicators in that fat pocket area is enough. If it's like where we can like pinch it and it's kind of like a normal pinch that we can do, usually that one cycle is enough. But if it's a larger area, we might want to do 2 sets of cycles, which that would be you come in and then about 8 weeks later, we do another one. But that's why we assess you, because obviously everybody's body is different. Everybody's pockets of fats is different. We can do a chin area. Sometimes chin, if it's just like a little pocket underneath here, could be 1 cycle. But then sometimes that pocket extends, to the outer side that we have to do 3. Just depends on how it's going to be best to give you that most sculpted look. The best part about CoolSculpting is because it happens gradual, you typically don't get loose skin from it. Your skin gets tighter kind of with it and goes with it. Now, however, if I have a patient that comes in and they're looking at their abdomen and they already have a lot of loose skin, it's not going to tighten that skin. That's already loose. So it's meant more for patients that have those pockets, and as it loses, it's not going to really change the integrity of that skin. It's just going to kind of keep it right where it's supposed to be along with it. You can do really any area. So we could do arms, we can do above the knee, we can do inner thigh, we can do outer thigh, we can do abdomen, we can do bra fat, back fat, flanks, the chin. I always call these the snacks. We can do that. So really any area that has a pocket of fat, if we can pinch it, we can treat it. When somebody's not a candidate, the only time that I would say that I have to turn patients away is if there's visceral fat on the abdomen. And visceral fat would be your fat is laying under the muscle. So it's kind of that hard abdomen in there where we can't really squeeze the area. But if you're not sure what you have and it's an area that bothers you, that's what consultations are for. They are always complimentary. That way we can assess you, really decide how we can best sculpt you. You can see how we can sculpt an area, and everybody's different on what they want their results to be. So if somebody wants a little bit gone, we might just do one session of it. If somebody wants a little bit more and they want more of like a six-pack showing, then we might do another session. So it kind of just depends on how much of a result. What happens though during that freezing process, and I love to show this, is fat cells are like marbles. So I always think about them as like marbles in a jar. And if those fat cells, they like to be all stacked together. So when we freeze that area of those fat cells, it destroys about 20 to 25% of those fat cells or those marbles in that area. So then over that 16-week period, those 20 to 25% of those fat cells that were destroyed get processed out through you. You don't see it happening. It just slowly happens over time, but you notice your pants are fitting better. You don't have that muffin top hanging over top. Patients always come in on their follow-ups and they're like, I can definitely tell. I can feel it. It feels different. And then when we take the before and after pictures, you can really see the change. So definitely set up your complimentary consult. That's what we're here for. We will help to assess you and help to decide what's the best way to sculpt you with CoolSculpting.